Whether or not a dog was exposed to tick was unfortunately not documented in the majority of records. Of the 42 dogs, only 14 had written in the record no tick exposure, or yes, the dog was exposed to ticks. Of the 5 dogs where it said, yes, this dog had tick exposure, all 5 of those dogs had 1 or more canine vector-borne diseases. And to me, that says that those ticks that are out in that area are infected with 1 or more of these diseases, and they will likely transmit the disease. So that's really, really important. If we're living in an area where those ticks are present, tick control is really, really important if you don't want your dog to get sick. 9 of the dogs that were reported as having no tick exposure, 1 actually did, and that's not that uncommon. I know in the past with my own animals, especially if they have thicker fur and around like the neck where you might not necessarily pick up a tick right away, you can find a tick that's quite engorged, and those ticks may feed for a couple days and not know it and then drop off, and you never know that they actually were there. Again, in this study, infection with Ehrlichia and Babesia was most common. Ehrlichias respond to doxycycline pretty well. Babesia does not. And so although the clinical practice of doing a doxycycline course to supplement immunosuppressive treatment is not particularly negated, but we have to remember that there are other diseases that are vector-borne that would not respond to doxycycline. Babesia can be very, very difficult, and so that is one tested for and speciated out. Although it really increases the costs of the diagnostics and treatment, if we want to have a positive outcome, that's going to be our best course of action. From a pet owner's perspective, we have to wonder, are these tests really worth it? And I'd say in certain instances, yes. Oftentimes, just treating with an antibiotic may make your pet better. However, this paper does demonstrate that ticks, particularly in Southern California, but potentially all over the place, do carry a high rate of infectious diseases, and a tick bite can have very, very serious consequences. And potentially spending a little bit of money at the beginning for testing may save hundreds of dollars down the road with medications, blood transfusions, additional testing that may have not been needed because we actually found the underlying cause of the condition early on in the testing process. As far as the specialist spin, if there's ticks in your area, do heavy tick prevention. If you see ticks on your dog, test for vector-borne diseases if they get sick. And that's this week's VetVine Specialty Update.